Next, we will be hearing from Danae Hebert on telehealth trends and reimbursement in Louisiana. Danae is the State Office of Rural Health Manager at Well Ahead, Louisiana, a chronic disease prevention and healthcare access initiative of the Louisiana Department of Health. In this role, she serves as the manager and main point of contact for the State Office of Rural Health Grant Program, as well as the Telehealth and Project ECHO initiatives within the Bureau of Chronic Disease Prevention and Health Promotion. She also serves as the Texla Telehealth Resource Center liaison for Louisiana. So we're very happy to have her join us yet again today. Prior to joining Well Ahead, she worked for over 6 years in hospital corporate compliance, specializing in hospital licensure and certification and promoting interoperability program. Danae holds a Bachelor of Arts degree in Spanish with a pre-medicine concentration and a minor in Latin American Studies from Millsap College. She also holds a Master's of Business Administration degree with a concentration in Healthcare Administration from the University of Louisiana at Lafayette. She is Louisiana Notary Public and certified in healthcare compliance, and we're very excited to have her here today. So thank you, Danae, and we look forward to hearing what you have to say.
All right, thanks, Cameron. Can you hear me okay? Okay, good. So good afternoon. Cameron did a good lengthy introduction of me, so I'll just move right into my presentation here. Well Ahead is partnered with TxLaw to serve as the support representative for Louisiana. And so we're really excited about that partnership. And this presentation is a part of all that we do in partnership with TxLaw to make sure that providers across both states have all the resources that they need to do telehealth effectively. So today I'm going to go through the 2021 legislative and regulatory activities in Louisiana. These are our learning objectives for today. So hopefully by the end of the presentation, you'll know all about all the recent telehealth related legislative action and the Medicaid policy changes, and be able to identify how these might impact your practice. So I do want to do just a really quick review of some of the 2020 activity, just as a little bit of a refresher. Some of you are probably aware of these things. So I just want to do a quick review. From a legislative perspective, these are the bills that were introduced during the 2020 regular session. And there are 3 here that are listed as passed. And so I'll talk a little bit about those. These were the ones that were passed. HB 449 specifically allows for behavioral health services to be provided via telehealth. House Bill 530 requires health plans to display their remote patient monitoring policies. And then it outlines some requirements for reimbursement if a health plan does cover remote patient monitoring. And those are very specific requirements. And so as those insurance providers are listing those requirements, there's quite a lot of detail in there. And then the last one here, House Bill 589, requires Medicaid to provide an exhaustive list of telehealth covered services, the process for reimbursement, and the conditions for reimbursing providers that are located out of state. After review, Medicaid actually determined that they were already meeting all of these requirements, and they didn't actually implement any changes in response to it. In response to COVID-19, Medicaid did make several changes last year. The most significant change to the Medicaid policy was the ability to use audio-only connectivity for telehealth visits. They also adopted the OCR guidance for allowing non-HIPAA compliant platforms to be utilized. And they issued several informational bulletins, adding some services that were reimbursable during the public health emergency. You can see several of them listed here. And they continue to issue updates and changes through these informational bulletins. They just pretty much have left the same ones for a while, and they've just been updating those. And we'll actually look at one of those a little bit later in the presentation. So moving on to the 2021 regular session. We'll talk about the House bills first. So this is a list of all the proposed legislative action from the House that mentioned or was related to telehealth or telemedicine or could impact telehealth. There's a brief description here of each. And then I'll go through in the next slide these two here that passed in more detail. This last one was re-engrossed and is subject to call. And what it does is if it were to be implemented, it would expand the authority of APRNs, advanced practice registered nurses, to practice without physician supervision. And so that would significantly impact kind of just the way that healthcare is delivered by APRNs. And so we're watching that really closely, and a lot of stakeholders are watching that one really closely. So House Bill 79 was signed and became Act 372. You'll see here all of the acts are actually hyperlinked. So if you want to go back and look at those at more detail, these slides should be available to you after the session today. So you can go in and look at any of these in more detail. But this rule adds language to related to licensure for behavioral health providers. And in this specific rule, behavioral health providers is defined as a facility, agency, institution, person, society, corporation, partnership, unincorporated association, group, or other legal entity that provides behavioral health services. So it's more related to the licensure of the legal entity of a behavioral health provider rather than like the mental health provider professional themselves. That's a separate rules. So this is the previous language that's in the rule that states that the license for a behavioral health provider is issued for and valid for a very specific named geographic location. And the revision to that language actually expands the geographic location. And so it now includes the whole parish, the contiguous parishes around it, and any location within a 50-mile radius. So that's a pretty significant expansion of what is now considered like the geographic scope, the service location for a behavioral health provider license. So the next one is House Bill 270, which is now Act 266. This is actually a pretty significant bill that we commented on from a well ahead perspective. And so this one actually changes the definition of telehealth and telemedicine in a couple of places in Louisiana revised statutes. So the first one is revised statute 37, 1262, and 1291, which are related to the practice of medicine, surgery, and midwifery, as well as revising revised statute 40, 1223, which is known as the Telehealth Access Act. And that act outlined requirements for rulemaking regarding telehealth in Louisiana. So in revised statute 37, again, this is specific to the practice of medicine, surgery, and midwifery. The previous language listed here defines telemedicine as the practice of healthcare delivery, diagnosis, consultation, treatment, or transfer of medical data with interactive technology. And it requires a two-way video and audio communication, and it explicitly excludes telephone and email. The revised language actually adds this term, you can see here bolded, by a physician. And then it also adds, further down underlined, various forms of electronic communication, including asynchronous store and forward, and synchronous interaction, but it does explicitly exclude email and fax. And so this obviously expands the definition of telehealth, of telemedicine, by removing that two-way audio video requirement language and adding these other methods. But we are a little bit concerned about the addition of the term by a physician, because it could potentially limit the ability of nurse midwives to utilize telehealth based on this rule. We haven't seen any actual comment or specific pushback necessarily from the nursing board on that. but it was something that we did comment when we issued comments to the legislature that may be a concern. Also in this revised statute in the exemption section, this is language that was already there. It actually didn't change. The number changed. So they added another exemption ahead of this. And so this bumped down to 1291.7. And the new language is listed here, where they exempt e-consults with physicians licensed in other states or jurisdictions. And then moving on to the revised statute 40, which as a reminder is the Telehealth Access Act. In this rule, the telehealth was previously defined really broadly as the mode of delivering healthcare services that uses information and communication technologies. And it listed several examples, which included direct patient care, care management, consultation, education. So it was kind of that bigger, broader definition of telehealth rather than like the more specific definition of telemedicine as that direct patient care. So it was a broader telehealth definition. The revised language actually kind of narrows the definition down, and it makes it really more in line with that telemedicine definition that we saw in revised statute 37. And so this was one thing we commented on, that other stakeholders kind of in the telehealth space do have different definitions for telehealth and telemedicine, and that the broader definition that was actually in here before, that included education and all of those other things, was more in line with HRSA's definition. So we did kind of issue that comment and make them aware that having the telemedicine and telehealth defined differently, and telehealth being broader is kind of more in line with some of the other stakeholders. But the language was adopted as it's written here on the screen. So moving on to the Senate activity, we have 3 listed here that we will talk about. This first one is Senate Bill 29, which it became Act 223. And this allows the Commissioner of Insurance to take certain emergency actions. So there are actually several actions that were included in the bill, but I only listed here the things that were pertinent to telehealth. So per this bill, when the governor declares a state of emergency or a public health emergency, the Commissioner of Insurance may issue emergency rules to address medical coverage of a number of things, which includes removing restraints on telehealth and telemedicine access and expanding remote access to medications. And so this could allow for a quicker response to increasing insurance coverage and access for telehealth services and getting medication access during an emergency event. Senate Bill 93 became Act 92. And this one is specific to hearing aid dealers. So it revises information in revised statute 37-257, which is the regulations that's specific to hearing aid dealers. And it also revises some language in that Telehealth Access Act at revised statute 40. So this revised statute 37-2457, they added language here that actually requires the Louisiana Board for Hearing Aid Dealers to create rules to allow hearing aid providers to utilize telehealth. So we'll be looking for some more specific allowances to come out of this rule with some rules around how they can do that. And then they've also in that Telehealth Access Act, in this very long list of healthcare providers in the definition section, they just added licensed hearing aid dealers as a provider that is considered a healthcare provider in the Telehealth Access Act. So finally, there was a Senate concurrent resolution, number 59, that requests the Louisiana Office of Public Health to study the healthcare infrastructure needs in Louisiana. And this includes digital and data infrastructure, among a number of other factors. And so OPH is directed to submit this report by December 1st of this year, which is a pretty fast turnaround. And so this is something that's going to be led by kind of the upper levels of the Office of Public Health. But our office at Well Ahead falls within the Office of Public Health. And because of our work in telehealth, we are anticipating being tapped to assist with this project. We don't know what it looks like yet. So we're kind of waiting on some guidance from them. But we're really hoping that this is going to be a really good opportunity and tool to help identify where we have some gaps and where we have needs, particularly in the rural communities, and help identify and bring that support to expand telehealth in the future. So that's all of the legislative stuff. So now we'll look at some recent changes from Medicaid. Informational Bulletin 20-5, which is the COVID-19 provider update. This has been our primary source of information from Medicaid on updates to the rules during the public health emergency. And I've actually linked it there for you to look at. So the language that you see here regarding e-consults, stating that e-consults are not reimbursable, they're not payable. This language has actually been sitting kind of in that informational bulletin for a while. And then early this year, January 15th, they issued an update and this language was finally removed and it was replaced with this language here. So they notified that e-consults are now reimbursable as of for services on or after March 15th of this year. Reimbursable providers include physicians, APRNs, PAs, psychologists, and other licensed mental health professionals. It goes on to provide a pretty good amount of detail for e-consults. So it does state that e-consults must be conducted through a secure exchange and meet all the HIPAA and security requirements, and indicates that e-consults must involve electronic communication with the specialist and be compatible with the treating physician's EHR system. There is an exception to this requirement during the COVID-19 public health emergency. If they can't meet all these requirements, the provider has to document and justify why they couldn't meet all of these HIPAA requirements. But there is a specific exclusion during the public health emergency if this is not doable. E-consults are not reimbursable within 14 days of the patient's visit with the specialist if it's for the same issue. So if they're doing the e-consult and the patient had a visit with them within the last 14 days, and this is kind of a follow-up, or if they then refer and that patient goes and sees that specialist for the same issue, they can't bill for that if it's within 14 days. So it has to be a completely separate e-consult. This is the relevant CPT procedure code 99541 that's listed in the informational bulletin. And there's a lot more detail in there in the bulletin. So if you are interested in doing e-consults and billing Louisiana Medicaid, please go look at that and read all the detail and make sure that you're doing everything right. It doesn't appear that this is the reimbursement for e-consults is tied to the public health emergency. The way that it's written, it does appear to be, this is the rule now, they reimburse this now. The only exception is that the HIPAA rules normally apply. And right now during the public health emergency, the HIPAA requirements are waived if they can't be met. If you can't use a secure platform, then under the kind of the general OCR waiver that's ongoing. And then after the public health emergency, the HIPAA rules would apply again. In this same informational bulletin, in May of this year, there was a slight change in some of the language regarding kind of the general use of telehealth. So prior to this, back in March, April of 2020, the language in here and the language that was coming from Medicaid very strongly encouraged the use of telehealth, if at all possible, if it was medically appropriate, if it was safe. So it was a really strong encouragement to use telehealth and over in-person services. And then the language has been tweaked here to add this kind of bolded underline section, which kind of restricts it down to, we really encourage it when there's COVID-19 related restrictions that make it necessary. So this doesn't actually impact any policy or reimbursement, but it is a little bit of a tonal shift because it went from, we really want you to use telehealth to use telehealth if you need to for COVID reasons, for mitigation reasons. So it is a little bit of kind of just a tonal shift from Medicaid. However, based on my conversations with our contacts at Medicaid, they do seem to be both at the kind of the traditional high level Medicaid level and also the managed care organizations do seem to be really interested in continuing and expanding telehealth beyond the public health emergency. And they're looking at it, they're reviewing the data, they're looking at utilization and cost and all of those things. And so I think they're still interested in using it and they still want providers to use it. So as we move through and hopefully past the public health emergency, I don't think that they're gonna pull back a lot of rules or anything like that. And Louisiana Medicaid was pretty broad on telehealth before. So I don't think that there'll be any huge changes after. So I did want to touch on one other potential change that might be coming in the near future. The Louisiana Board of Dentistry issued a notice of intent in November of last year related to teledentistry. I don't actually think any changes have been made in the administrative code yet, because then I checked, it didn't look like the changes were in there. But what they want to do is add language to allow Louisiana dentists to perform teledentistry at the same standard of care. And then they're also seeking to allow hygienists in certain circumstances, specifically at community health clinics, to perform radiographs, oral prophylaxis, sealants, and fluoride varnish under the supervision of a dentist via teledentistry. And so this would, if this was implemented, it would create a really good opportunity to expand access to dental care, particularly in rural communities. And I know we have a dental team that's really interested in this for school sealant programs to help expand that, to give children access. But there are some concerns, particularly from the school sealant program, that Medicaid may not reimburse this, and they're only allowing some teledentistry with some restrictions during the public health emergency. And so we haven't really seen any clarification about teledentistry reimbursement from Medicaid, particularly after the public health emergency. So we're keeping an eye on that. And that is what I have for you today. Again, these slides should be available to you, so you can follow all the links and look at all the detail. But does anyone have any questions for me at this time?
Thank you very much, Danae. It looks like we do have a few questions in the chat. So Dr. Phillips asks, we heard from Carmen Irwin earlier about the public comment period for telehealth CMS rulemaking. What do you think might be the key things in Louisiana that are low-hanging fruit for continuation after the pandemic, and some of the telehealth rules, particularly related to reimbursement, that we might see continued?
I think it's kind of hard to know. So there's things that, I think everyone's interested in pushing to keep. So audio only is a big one. And that is one that I would say, if that's working for you and it's working for your patients, tell them, tell CMS, tell Medicaid, anyone who asks you, whatever is working for you, tell them that it's working for you, and tell them in what situations it's working for you. So audio only is a big one. Obviously, RHCs and FQHCs serving as the distance site is a huge, huge one. And based on what I've heard, I think that CMS does want to continue that in some fashion. I think also it would be important if you have the opportunity to talk about if the current reimbursement model for RHCs, if you are an RHC, if it works for you, because it's like one code for whatever you're doing and it's not at your all-inclusive rate for Medicare. For Medicaid it is, but for Medicare it's not. It's the 90 whatever amount it is. I don't remember now the revised amount. But does that work for you or not? Does it need to be the all-inclusive rate? Does it need to be a different rate based on what you're doing or whatever the case may be? So I think that feedback would be important to do. Cameron, you're muted.
Dr. Santos asks, are tele-ICU or critical care telehealth consults reimbursable services?
Telehealth ICU and critical care. Probably I would need to know more detail. Off the, like my gut is I think yes. But there's a lot of kind of caveats to that depending on
Of course.
a lot of factors. I'd be happy to help you with that if you want to email me that question. And we can do some research.
Is there a link or website where we could get the updated legislative information for Texas and Louisiana regarding telehealth?
So Texas, I'm going to have to punt that one to you guys. But for Louisiana, we actually, let me go to the next slide here. Our Well Ahead website. So we've got the COVID-19 one, and then we have our telehealth page. The COVID-19 page has a lot of FAQs, which would include some of those updates, and our telehealth page. So a lot of the big updates would be there, but it's not really easy. You kind of have to go to the Louisiana legislature and search for telehealth.
And I'll go ahead and answer that for Texas. The answer is yes. I believe it is the Texas eHealth Alliance maintains that information, and I'd be happy to pull it up and share that here into the chat.
Yeah, and the Center for Connected Health Policy, which is also listed here, that's part of our consortium network. They do a really good job of keeping up with the big stuff in particular, the trends and those sorts of things. So you can find kind of the rules for all the states on that website too. They do a really good job keeping up with all the policy stuff.
I don't want to stay away from the chat for too long, so I'll pull that website and provide it in just a moment.
Yeah, and I would like to, if we have any providers, I'm going to go try to find the link real quick. Next week on Wednesday at 11 a.m., Carmen Irwin, who's our rural health CMS person for this area, is doing a Louisiana Rural Health Town Hall meeting where she wants to hear from all the rural providers in Louisiana about what's working, what's not working, feedback on rules, on COVID, on, pretty much everything, what's happening in rural. So if you're not already registered for that, I definitely recommend, I'm going to try to find the link to register here real quick. So I can post that in the chat.
And to our audience member who asked about the Texas legislation, you can view legislation for all states at the Center for Connected Health Policy website. I've put in Texas's pending legislation into the chat, but it also lists current laws and regulations and is a great reference for your resources. Danae, are you pulling something up or? Have you stopped sharing? There we go.
Yes. Oh, sorry. Here we go.
Perfect. Are there any other questions for Danae that we can ask before we conclude? Seeing none, thank you very much, Danae. We always appreciate your input and keeping us up to date on what's happening in Louisiana. And we look forward to collaborating to get some of those responses for CMS and those rural health listening sessions.
All right. Thanks so much.
Thank you.